Hi everyone, Dr. Demito here. We're going to talk about population health, promise, health promotion, and disease prevention. So let's define first what a population is. So in this course, we're moving from public to population. And this course itself is going to focus on a lot of vulnerability for some specific populations. So what is a population? So it is a collection of individuals. They have one or more personal or environmental characteristics in common. So they can be defined geographically, like a school district, city, country, county. You can get smaller and smaller. Or circumstances, like the survivor of a disaster, a flood. And there are different types of populations, vulnerable populations like the homeless, the very young or the very old, and those lacking access to services. Clinical populations, they can be defined by age, risk factor, or chronic disease. So, or defined by jurisdiction of administrative overlook, like a clinic, a hospital, a school. So a jurisdiction that has a great overview of a specific population or group of people. All right, so you're going to read about this in your NASH book in your readings, but an executive summary of what is this promise. So population health's promise is to promote health and prevent disease. And this is a strategy that was created to create an epidemic of health and wellness. Population health is defined as a distribution of health outcomes within a population, the health determinants that influence distribution, and the policies and interventions that affect those determinants. Again, we're going back to the social determinants of health. So in this reading and in this whole mindset is where the social determinants of health came from. They're relatively new. I believe that I started introducing them into practice during COVID, 2020, 2021. So in healthcare, that's a relatively new process. So population health defined, and we talked about the distribution of health outcomes within a population, and population health is holistic. It seeks to reveal patterns and connections within and among multiple systems to develop approaches that respond to the needs of the population. So, for example, a population might set forth with a specific set where the interventions that you have come up with aren't going to work. Okay. So you have to refine what you're doing to the population that you are hoping to help. So if you had I'm trying to think of an example. So if you had a population of blind individuals, you wouldn't give them books that aren't in Braille to help teach them how to protect their coronary system, right? You wouldn't do that. So we need to adapt our interventions to the specific population. And one of the things I noted, I worked in women's health for 18 years before I switched to family. And it was very interesting. I worked in an organization with a very diverse population, and I found that there were certain cultures that expected things to be, or not expected, that's the wrong word, but for example, one population only wanted to drink warm things after the delivery of their baby. No ice chips, no ice water, it had to be warm. Another one had certain foods. The one culture I had, which I thought was the most interesting, was that their baby could not wear clothes until a certain date. I can't remember what it was, but and it was midwinter, freezing cold outside. So we had to come up with a strategy to accommodate the patient's belief system or their culture, and still keep the baby safe and not cold. So lots of considerations that we need to think about. All right. So the challenges in the population health of America and NQF efforts to meet these challenges. It's committed to helping our nation achieve better and affordable care, and it sets these standards, recommends measures that could be used for payment and public reporting, identifies and accelerates QI priorities, advances electronic measurements, and provides information and tools for healthcare workers. And the National Quality Forum mission is to improve the quality of healthcare. You may want to go to this website. It's pretty interesting to go there and you could actually see what they're working on. Promote attainment of national goals through education and outreach programs. There are so many great programs out there that we don't know about. And as healthcare providers, whether you're on the leadership track or whether you're on the NP track, we need to know about these so that we can provide these services to our patients. Big problem. There's a big gap there, I see, as an active provider, that a lot of services that we're unaware of. And I try to keep up on them since I work so closely. And I also try to advise my peers of them as well. All right, so how improving the healthcare, how will it happen? It requires a comprehensive agenda. We need to improve insurance coverage, get rid of silos, which unfortunately right now I see happening a lot. Providers must work cooperatively to advance seamless coordinated care with transverse settings, health conditions, and reimbursement mechanisms. Interdisciplinary teams of providers to manage chronic conditions, and policymakers have to craft policies that support illness prevention, health promotion, and public health. And I really like seeing that nurse practitioners are finally being utilized as providers, because that's what we are. We go to school for a long time. We work very hard. We have that experience. Nothing can compare with the experience of being a bedside nurse. Whether you're in leadership or on the clinical track, nothing can compete with that experience that you have gained by working at the bedside. And you deserve to be treated as a peer and not a subordinate, because you're not. The current state of America's population health. So when you compare America to other countries, we spend more on healthcare. So 17% of our gross domestic product, and yet we score lower on quality of care, access to care, efficiency of care, equity, and healthy living. So unfortunately, that's reality. There's a stress in our healthcare system due to increases in life expectancy of more than 30 years during the 20th century. So we've got an aging population. We have a huge population of aging nurses. And we need people at the bedside too. I tell my daughter is a nurse. She works in orthopedics up in Wisconsin. And I had asked her, well, Elizabeth, when are you going to go get your master's degree and become a nurse practitioner like your mom? And she said, never. I love working at the bedside. I will never change. And she won't. She loves it. And I say, you know what? Hats off to you, because we need you. So many bedside nurses are going into other fields. Healthcare quality is suboptimal. Patient safety is lagging. I mean, I've been a nurse for 35 years or more, and patient falls is still an issue. Okay. So I have seen more projects implemented in healthcare about patient falls, but it hasn't really made a huge impact, has it? I don't think so. Public health programs are underfunded. I think a lot of times that the funding is there, but it's misappropriated. And about 2/3 of Medicare recipients contend with 2 or more chronic conditions. 1 out of 6 deal with 6 or more. And these chronic conditions require frequent monitoring and evaluation. And we just do not have an appropriate healthcare system set up right now. When I think about it, we really need to work toward increasing the health and identifying what is causing these health inconsistencies in this country. All right. So moving from a sick care system to a well care system, that's what this is all about. So this is a good time to look back at that 3 buckets of prevention PowerPoint that I recorded earlier. But in the past, the sick care system's been supported by payment policies that rewarded both consumers and providers for health care. There was a time back in the 60s that you would go into the hospital a day or two before surgery. People would go to the hospital because they were just stressed out and they needed a break, and insurance would pay for all of these things. You would go in and you would have surgery and you would be in for 2 weeks. Well, we know that staying in bed for 7 days after a cesarean section, which is what they used to routinely do, is not a good thing. It increases the risk of blood clots, atrophy, all sorts of things. You got to get up and moving. So true population health can only be achieved when placing a great emphasis on preventing that disease process. And here we go looking at the determinants of health. We're going to talk more about the social determinants of health as we move forward in this class. But it's the interaction of all of these determinants that influence health outcomes. So we have to include our relationships, rules and regulations, policies, laws, individual health choices, genetics. That's a big thing, and it's out of our control. Water, sanitation, agriculture, risk exposure, employment opportunities, and access to quality health care. So I think about this during COVID, since it was not all that far long ago, and I'm still seeing cases in clinic that healthcare workers didn't have appropriate PPE to be working with these patients. They were reusing N95s. I can remember because I wasn't I wasn't working at the hospital, but I was in a clinic at the time, and we had patients coming in with suspected COVID, and we were given this little Rubbermaid container that we were supposed to keep our N95 in and reuse it between patients unless it became visibly soiled. I mean, come on, that's crazy. I now keep about 40 N95s that I bought off of Amazon in my work bag because I'm not taking the risk that, number one, the clinic doesn't have them, or that they don't have the ones that I like, because I'm very particular about my N95s. But need to have access to PPE, and that goes for other fields as well that are at risk of exposure. The foundation of public population health. Gone is the old. So in the past, we expected healthcare providers to care for their own patients in their own practice setting. Now we treat populations, and it can be achieved with teams of providers cooperating. The aim is to increase prevention and screening practices and improve adherence to recommended treatment in accordance with evidence-based, nationally recognized guidelines. And as providers and in leadership roles, you need to know those. Every time I have a patient come in, I don't care what they've come in, I make sure that they're all up to date on their screenings. I ask them about their immunizations, because most people, once they get out of school, they are not thinking about immunizations. They're not thinking that they need to have a tetanus shot every 10 years. They're not thinking that if they have asthma and they're increased risk, they need a pneumonia vaccine. So, I mean, there are things that we need to consider and ways that we can help prevent illness from occurring in our populations. All right. Key priority: managing chronic disease. And here's the chronic care model. You can see community resources and policies, the health system, and self-management support, delivery system design, decision support, clinical information systems. All goes down to informed, activated patient, productive interactions, prepared, proactive practice team with improved outcomes. So if you have a patient, for an example, let's say has asthma or has COPD, we know that there are certain interventions that need to be in place for the patient to move toward better health, right? They are never going to be cured of this disease, but to have better health means to have better outcome. How is that measured? That could be measured by an increase in their spirometry. It can be a decrease in their use of rescue inhaler or nebulizer treatment. It can be measured by going up 2 flights of stairs when they could only go up 1 flight of stairs before. So there are many, many different ways that you can measure to look for positive outcomes. in chronic disease. So hypertension, the same thing. The patient is measuring their blood pressures, and their blood pressure stays within a certain range over a period of time. The same thing with diabetes and their hemoglobin A1C. That is like the big predictor of management. I can remember when that test first came out, and it was for not everybody got an A1C. Now I'm doing A1Cs on everybody every 3 months to make sure that they are staying compliant in their treatment regimen. I have had patients come in that, because I work in urgent care, but they let us do primary care there. I've had patients come in who have been diabetics and they don't know what they should be eating. They've never had a consult with a dietitian or nutritionist. What? That is just crazy to me. So we really have to delve down and ensure that our patients are utilizing those services that are out there for them. Let's look at this, the effect on and response by the marketplace. So the realm of business, trade, and economics. So business have a substantial stake in their employees' health. We want to decrease the cost of health benefits while maintaining quality health care. We don't want patients, or we don't want people calling in sick and in the hospital. Oh my gosh, we're short-staffed enough, right? We don't want that happening. But that's the way it is in every place of business. They don't want their employees calling in sick. They don't want their employees coming in sick. So they want to keep them healthy. A healthy employee is more productive on the job. They don't miss days of work, and that generates a positive return on their investment for employers. So you can see by this statistic, and this is old from 2009, we've got to start looking for some more recent statistics. An average of $3.27 in healthcare costs was saved for every dollar spent on an employee wellness program. So great employee wellness programs in many organizations. So I hope everyone's taking advantage of those if you work in a big system. All right, so let's look at this. Health, population health, and politics policy. Now, this changes every 4 years or every 8 years. We get new leadership in the White House, and their priorities are different, and their policies are different. So we need to adapt to these things. And we need to incorporate the considerations into the new policy that we are going to be directed towards. So we need to take these resources that are scarce, and we need to we need to utilize these resources where they're going to do the most good. So we don't need to have resources that are needed to be utilized in areas that have high incidence of tuberculosis, in areas that have low incidence of tuberculosis, right? So we need to ensure that we are implementing or have health services available in areas that are needed. So we need to build awareness and identify the population needs. Only then can we introduce policy. We need to recognize the importance of data measurements. As I said, you're going to be so bored of hearing me say I'm data driven, but that's how we really learn about things. And since implementing policies requires significant resources, stakeholders face difficult decisions about priorities. And this is the unfortunate thing. Everybody should be awarded the same consideration, right? It doesn't matter on your age or your ethnicity or your where you are, where you're located. You should all be provided the same resources, in my opinion. Okay, frameworks for intervention. Healthy People 2020. They now have Healthy People 2030, but we're still working on this one. So since 1980, Health and Human Services has been setting these national health agendas for a 10-year period, and it's based on a broad consensus and evidence. So there are 38 areas with 5 overarching goals, and I can't read these. Oh, here we go. Attain healthy, thriving lives and well-being free of preventable disease, disability, injury, and premature death. Eliminate health disparities, achieve health equity, and attain health literacy. to improve the health and well-being of all, create social, physical, and economic environments that promote attaining the full potential for health and well-being, promote healthy development, healthy behaviors, and well-being across all life stages, engage leadership, key constituents, and the public across multiple sectors to take action and design policies that improve the health of well-being for all. And Healthy People 2020 introduces the concept of cultural transformation and benefits of leveraging social and physical environmental influences to improve population health. Okay. When you read that out like that, it just sounds like a lot of the same thing, right? To me. But if you look and you dissect it a little bit, we know that we want to be free of preventable diseases, eliminate health disparities, create economic environments to promote health potential, promote a healthy development health behaviors for well-being across the lifespan, engage leadership. So they add, in my opinion, they have added a lot more words than need to be. I like to narrow it down a little bit, but then again, I'm that small scope of change person. I think when you have this big itinerary here, it waters down the essence of what you're really trying to attain, and that is to provide reduction or reduce or eliminate preventable disease, eliminate health disparities, create well-being for all, promote these factors across the whole lifespan, and engage leadership. So that's what it means to me. It may mean something different to you. Now, currently, in Healthy People 2030, well, actually, this is 2030 here that what we're talking about. Good. I'm glad because I thought it was 2020. I was looking at the wrong one. Okay, frameworks of innovation. Institute of Healthcare Improvement. And I've worked with this company, oh gosh, when I worked at the hospital, I was a nursing director there for 5 years. And this is where I learned about the small test of change through the Institute of Healthcare Improvement. And that is their goal. Their whole mission is to improve healthcare in this country, in the United States, although it is becoming a worldwide organization. So the Institute of Healthcare Improvement has 3 aims. And at the core of the initiative, it's to optimize value. And the example of a directive to this initiative, the most appropriate care should be provided with respect to overuse, underuse, and misuse. Healthcare systems must reduce hospitalizations, apply resources to patient care, and is commensurate with their needs, and build sustained relationships that are mindful of patient needs. So they have this little triangle over here says, again, few words. On the other side, the left-hand side, lots of words, but it gets the essence across here. Improve patient experience with reduced costs and improved population health. That's their goal. That's their framework. And they have a really, really good website that you can go to that teaches all about the frameworks of innovation and how to institute. Their belief is a small test of change. For example, this is what I learned. I've gone to several of their conferences, and they really minimize the thought of it, but I think it makes a little bit more sense. So you have a patient that needs to begin going on a low-fat diet. So they're very resistant to it. So let's take one low-fat item that tastes really yummy and include it on their tray or include it in their diet plan. And then when you have a conversation with them a week later and you discuss and you do a diet review and they say, my gosh, I really like that. I had no idea that that was a low-fat item. Well, aha, it was. So now let's do another one. And that is these little small tests of change is a way to get patients to comply to positive healthcare regimens. And you can utilize this not just in diet, in almost anything. I implement it myself in my healthcare practices. And so if you have an opportunity, I know you're super busy in your lives, go in and check out the Institute of Healthcare Improvement, and you can find some very interesting data. All right, let's look at this one. The Frameworks for Innovation. The National Priorities Partnership, it was initiated in 2011. It has 52 major national organizations with the goal of transforming healthcare delivery. There are 4 key challenges: eliminating harm, eradicating disparities, reducing the disease burden, and removing waste. To address these challenges, they established 6 national priorities, including working with communities to promote wide use of best practice to enable healthy living. And I don't personally know a lot about this organization, but it certainly seems as though their mission is geared towards improving population health, which is a good thing. And I'm familiar with their strategies, so good to know. Prevention strategies: primary prevention, secondary, and tertiary, and we're used to these terms in nursing. So primary includes targeted health promotion and wellness activities to prevent illness. Lifestyle modifications, like reducing tobacco use, eating healthy foods, increasing regular physical activity. Secondary prevention, like mammography, blood pressure, cholesterol monitoring. And tertiary prevention is focusing on minimizing disease complications and comorbidities through appropriate evidence-based treatment and continuity of care. The 4 pillars of population health include chronic care management, quality and safety, public health, and health policy. So chronic care management involves evidence-based clinical management, and quality and safety relies on activated patients and provider teams that are motivated to examine the structure and organization of healthcare delivery. I always liked, when I was in a leadership role, I liked to include patients when we were implementing major process change. I did this as I had I brought in patients when we were dealing with fetal loss and how we best could serve our patients. That was one methodology. I also had a focus group to identify exactly what patients wanted following the delivery with their baby. They wanted their babies to stay with them after the delivery and not be whisked off to the nursery. So I always or made every effort to try and include patients on those quality initiatives. The first pillar of chronic care management, you can see these: care coordination and education with screening of chronic illness, treating the chronic illness. And on page 14, it goes into more detail on this particular pillar. We have quality and safety and public health policy. And it's important to understand that to err is human. And this is, as far as I love quality and safety. Looking at the numbers, you can find out what works and what doesn't work. Rely on activated patients and a system-based approach. Realize that accidents happen, not only to healthcare providers in the field, and design and modify processes to make the delivery safer. Making safety rounds as a leadership member or a part of the leadership team is paramount as far as I'm concerned, to ensure that you are addressing potential near misses in the field. And I used to do that, just walking around and talking to staff about what they felt was a potential hazard in the workplace. Community health and policy, addressing community-wide concerns, the health determinants, health disparities, disease burden, policy support, pay for performance, transparency, accountability, relies on data and data transparency. And this is happening a lot too. And I don't know how I feel about it, but some insurance companies are doing this pay for performance with providers, and I'm not sure how I feel about that. I think that it is something that was um, kind of put on the bench during COVID, and it's not really geared its head. I say over and over again, it's 2025, but COVID was like yesterday to me, and it probably was to you too. So it's still us COVID. The side effects of COVID are still out there.